Welcome back to the Bigger Than Birth podcast, where we're celebrating bigger bodies and beautiful births. I'm your host, Victoria Gaba, and each week we will be bringing you the real stories of plus-size moms as they share their journey through fertility, pregnancy, birth, and postpartum. These stories highlight what it's like to navigate through this experience as a woman in a bigger body in hopes of creating representation for plus-size moms, both present and future. Thank you for being part of this community as we share these stories that are so much bigger than birth. Welcome to today's show. Today we are joined by Melissa, a New Hampshire mom of 3 who shares her years-long fertility battle, ending in 2 surprise natural conceptions. She shares her journey facing the lose weight to get pregnant narrative and also enduring 2 pregnancy losses due to ectopic pregnancies. Melissa discusses navigating the hospital system with a higher BMI and having to be referred to a different hospital due to BMI restrictions. We go into her experience with a possible misdiagnosis of gestational diabetes and both of her 38-week induction stories. While the first induction led to a very scary experience with her son needing NICU time, her second was very redemptive and a positive experience for Melissa. I would like to give a quick trigger warning before we jump in. Today's episode does contain talks of pregnancy loss, so if that's not something that you are in the mindset for right now, feel free to skip this episode or come back at a later date. Let's dive into Melissa's story. Hey, Melissa, thank you so much for coming on the podcast today.
Hi, thanks for having me.
We're super excited to have you and listen to your story. But before we jump in, why don't you tell us a little bit about yourself and your family and where y'all are living?
Sure. So I live in New Hampshire. I've been married to my husband for over 10 years, and we have 3 children. One is adopted from foster care, who's 12, and then I have a biological 3 and 7-month-old.
Very cool. So did you adopt early on before you conceived your biological kids?
Um, we ended up finalizing our adoption about a year and a half before our first biological child was born.
Got it. So big, happy family. That's so exciting. Well, we will talk about the kind of pregnancy and birth journey with your biological kids and kind of how all of that fit in together. So with your first, were y'all planning to conceive when you did?
Yes and no. So we had been going through infertility for a number of years, probably 4, give or take, and completely caught off guard. I think we'd kind of surrendered the idea that, wasn't in the cards for us. We had gone through a variety of like Medicaid assisted cycles. We had done all sorts of testing. There's always that pressure, lose weight and you'll get pregnant. For me, I didn't want to make any sort of huge lifestyle changes in order to create a family. So that's why we kind of pursued other avenues to do so. We actually just purchased a puppy. And then literally 2 weeks later, found out we were expecting kind of really out of the blue.
Oh, wow. So you went through, what did you actually do IVF or it was just like the IUI medicated cycles?
We had done IUI, a couple of cycles, 3. None of them took. We had 2 ectopic pregnancies actually in the midst of some Medicaid assisted cycles. But my husband didn't feel comfortable pursuing IVF for spiritual reasons. And so we just didn't go that route.
Got it. With the ectopic pregnancies, did those have to be surgically handled? And did they give you any indication that that could impact future fertility, or how did that experience go?
Yeah, so they were resolved through methotrexate, which is medication, so injectable medications both times. And they had happened not exactly a year between each, but about like 11 months between.
But they kind of said, okay, once this resolved, you can go back to trying, or did they push for more medicated cycles at that point, your doctors?
No, they kind of just said, wait 3 months is kind of the standard when you have that medication, just because it can deplete your folate. And so they said, wait 3 months. And after that, resume whatever you want to do in terms of treatment. At that point, that first one, we had decided to kind of take a break, so we did for a little while. And then the second time, we had already exhausted like the 6 months that our doctor wanted to do medicated cycles. And at that point, they're like, if you don't conceive within that period of time, we're going to refer you to, an IVF clinic to start doing some more. At that point, again, we're kind of like, well, we're just going to, put a pin in it for now and kind of see what happens.
Were all of those medicated cycles done through an OB, or were you seeing a specific fertility clinic?
Just my OB.
Okay. So then you take a break and you're kind of letting your body rest and reset. And then you find out you are pregnant. Did you miss a period, or how did you go about finding that out?
So I will say that I first but in both of my previous losses, I had experienced like this really distinct like headache. And it sounds crazy, but I had this headache and I both times were like, oh, it seems kind of weird. And I had been tracking my cycles during those times and I ended up being pregnant with both of them. And so randomly I had this headache and I was like, this feels weird. And so I took a test out of the blue and I was pregnant. And I was completely shocked because I hadn't tracked anything. My cycles had always been irregular, so it wasn't out of the norm to not have a period. And yeah, so I was completely shocked and it was totally unexpected.
That is so exciting. I know, like you said, once you kind of set your mindset of like, okay, we're going to take some time, and then to find out that it happened naturally after that experience is super exciting. So, talk us through, you find out, was your husband there when you found out, or
No.
did you have to tell him?
Yes, I had to tell him. And unfortunately, given our losses, like his first reaction was like, oh no. Like he thought, we were gonna go through kind of that heartache again. So we were definitely very reserved, very cautious. I don't think we told anybody for quite some time. Because we had already kind of gone through that whole process and having to untell people is so hard. But yeah, I mean everything for the most part really kind of just checked out.
That's amazing. So, once you found out you were pregnant, did you go back to that same OB that you had done the medicated cycles through, or did you look for a different provider?
So we ended up so it was technically through the same like hospital system. We went to a different physical office only because at the time I was working somewhere else. And so convenience wise, it was easier for me to go to that clinic just because it was like down the road from where I work. So I could pop in and out for appointments.
And early on, did you have any other symptoms besides that headache in the beginning of pregnancy?
In very early stages, no. I mean, I definitely got my waves and nausea, closer to like, the 7 to 8 week mark. But I feel like I somehow always found out super early. Like I was probably like 5 weeks at most, when I found out. So it was kind of that awkward, like I just must have had, showed up on a test sort of a thing. I remember going in for a placement scan because of my ectopic history. They saw me at like 5 weeks, 6 days or something, and they could confirm it was a uterine pregnancy, which was great because I never made it that far before. But there was still no heartbeat or anything. So there was still kind of anxiety around like, well, is this going to really pan out? So I went back 2 weeks later for kind of that reassurance, viability scan. And there it was.
How was it getting to see the heartbeat for the first time? Because, like you said, with the prior losses, you kind of were taking it step at a time, like, okay, we made it this far. Okay, we made it this far. Talk us through that first ultrasound and kind of seeing that heartbeat for the first time.
Yeah, it was definitely very emotional. And I'm not a super emotional person, so I wasn't expecting to be as emotional as I was. Like even like hearing about our losses, like I wasn't like I all processed everything later. Like in the moment, I was kind of just like kind of stonewall, just kind of rolling with it. And so I feel like I was really taken aback by finally getting good news and just those happy tears. It's like kind of the floodgates. And I remember looking over to my husband, like I was too scared to look at the screen, and I've tried to coach him like what to look for on these things because how most of us are. We're scrolling the internet, we're looking at social media, trying to find things like you want to look for this thing and it's going to flicker, and he was looking at me like, I don't know what I'm looking at. And I'm like, great, you're so helpful. Thank you. But then, our technician really early on was like, this is looking good. And so we had that like big communal sigh of relief.
That's great. And I know it still probably had that anxiety element because you had experienced the prior
Mhm.
losses. So,
Yeah.
talk us through, I guess, the mental piece of that going through first and second trimester. Did once you kind of get later in pregnancy, you have a relief, or was it always kind of in the back of your mind?
I think in the back of my mind, there was always still some concern that something could still go wrong. But then the other part of it was I kept telling myself, there's no way that like this could happen 3 times in a row. Like I know it does for people, but I was like, the chances have to be so like so slim. And I was constantly checking, like they have those miscarriage like rate calculators. I was constantly checking that weekly, and I was constantly messaging, a close friend of mine that I know had also had experiences with loss, and kind of having that check in is because it was so just like, well, if I end up having this baby, it was the big like if, even though it clearly was happening. I feel like it definitely delayed kind of the celebratory stuff or the, getting things. I was definitely a later to acquire sort of, um, for that preparation is because it was so uncertain in my mind.
Yeah, absolutely. And so once you got through kind of further into pregnancy, did you tell friends and family, or you kept that kind of reserved?
We ended up telling people like closer to like the 20-week mark. We were like more like halfway through after we got through like the anatomy scan and things were still trending in the upward direction. I know I think my husband told his family sooner than I did, but he kind of kept it to himself. But yeah, I mean, we definitely told people, as it kind of came up. I know like with my work, I was really reserved to tell folks, just given the nature of everything. But yeah.
And so, with your OB care, did you see the same OB throughout, or did you kind of cycle through a couple OBs at that practice?
So given my BMI, what was annoying was that was automatically classified high risk. I was about 322 pounds when I got pregnant. My BMI was like right at 55, I want to say. And that was the cutoff for my local hospital to deliver. So I had to go to a specialist, like a specialty facility, if you will, about an hour away from where we live to deliver. And they had specialists like maternal fetal medicine that I had to go to for the anatomy scan and certain particular tests, just given my BMI alone. Ironically, during pregnancy, I lost weight. So towards the end, they were like, hey, if you want to deliver here, you can. And at that point, I'd already been like, no, like I've already kind of surrendered the fact that this was going to be our plan. Like, and in the back of my head, I also kind of wanted to be like, well, I don't want you to get the compensation for this either, for kind of like that discriminatory nature. Cause it was very much like, you're so high risk, like your rates of C-section are so, up there and, all that kind of stuff. So I just kind of, you know, again, accepted that that was kind of my plan and my fate, if you will, of like, this is where I'm going to deliver and where I have my providers. And also kind of in the back of my mind, if they're best equipped to handle someone of my size, and that's where I want to go anyway.
Yeah, absolutely. I know there's a different tangent we can go on BMI and that actually measuring health, but how silly to have you on that cusp of like your health probably didn't change that much between the beginning of pregnancy weight and then whatever you lost pregnancy weight. But just having that arbitrary number be like, okay, well, you can come here now is so
Right.
silly to me.
Right.
So, talk us through going to see the maternal fetal medicine specialist. Were they going to be the ones that actually delivered, or did they refer you to a different OB at that hospital?
It really was like, "We're sorry, you're actually probably not gonna meet who you're gonna deliver because those people who deliver at the hospital don't work in these clinics nearby you. So unless I wanted to drive over an hour for every appointment, I wasn't gonna get the chance to meet my delivery team." Mhm.
Did that weigh on some anxiety, or like you said, you just kind of resigned yourself of like, this is what we're going to do?
I kinda just wung it because I knew, like, I couldn't change it, and just unfortunately, I was trying to save up, like, as much time as I could for my, maternity leave that it didn't seem feasible for me to take off all this extra time to go to appointments when I'd rather have that time with my newborn. So that's kind of accepted, like, oh, well, I won't meet them, but ultimately it is what it is.
Yeah. And even if you delivered at that hospital close to you, you run the risk of a different doctor being on call anyways.
Exactly.
So, it's always a toss up at some point.
hmm
So, as you got to the end of third trimester, how were your symptoms? Were you still feeling pretty good, or how was it going?
I was feeling pretty well, except I delivered like right before Christmas. So there was a lot of extra anxiety around that. Like living in New England, we have a lot of winter weather, so that was also a concern. Knowing I was gonna have to drive over an hour away for my delivery was very stressful. I remember like having my bag packed super early, just not knowing what was going to happen. We knew pretty early on that I was going to be induced at 38 weeks, so I had that kind of countdown. But I remember the whole week before just being like a nervous wreck. um, I ended up getting, I think I was just sick with like some sort of head cold or something, but all of those symptoms, like when you Google like early labor, you're like, oh my gosh, like this could be it. And so I was always on the edge of my seat all week long. My husband just kept telling my in-laws, like, we don't know, like it could happen whenever, even though we knew the date that I was going to be going in and being admitted. Spoiler alert, there was no no surprises, but that whole entire week leading up to it, I was just like, well, who knows what to expect, even though it went exactly as planned.
So, with the induction at 38 weeks, was that due to your BMI, or did they have other medical things that they attributed that to?
So, they did diagnose me with gestational diabetes in my first pregnancy. They had me do my gestational diabetes screen at a 12-week appointment that I was not expecting them to do. And that morning, I'd had like the carbiest breakfast you ever could have had. So I shockingly failed my glucose test like you wouldn't believe. And I was like, "Oh, I'm not shocked. Like, I didn't even know I was having it, and I had a bagel for breakfast. Like, what do you think was gonna happen?" So then they encouraged me, instead of doing the 3-hour test, to meet with diabetes nutrition. And so I was like self-monitoring my sugars and all of that. And for a good like month, they were looking fine. And then they started my fasting glucose like was trending up. And so they automatically just slapped gestational diabetes on me. And I started taking insulin at some point. I want to say around like 30 weeks. Um, but even talking to like my PCP, and like they tested my A1C and everything, we really don't think I actually had gestational diabetes. But either way, that was the primary reason, was the gestational diabetes. When I was admitted for the induction and they did labs, I was diagnosed with preeclampsia at that time. So it was good that I went in anyway.
Yeah, for sure. Did you have any swelling or was it protein in your urine?
Protein in my urine,
And had you felt any like differently up until that point, or was just that test that was like, hey, we need to get this ball rolling?
just that test. Yeah.
Interesting. Okay.
hmm
So then talk us through day of induction. You have it booked in, you head to the hospital. Talk us through how that started and how that went.
Yeah, I don't know how many hospitals are like this, but ours don't give you like a time to go in until the day of. So they say to just kind of be on standby. So I remember like that morning we had, or the day before even, we had like everyone had went where they needed to go. Our dogs were boarded. Our oldest son was with my sister. Like everyone was where they needed to be, and we just sat and waited like all day until 4 o'clock. And it was the most nerve-wracking thing, so I definitely encourage anyone to have plans to do something,
Keep
because it was
yourself
a
busy.
lot. It was a lot just to
Yeah.
sit around all day and wait. So we ended up getting to the hospital around like 5 o'clock or so. I remember like unpacking our bags. It kind of felt like a hotel stay, like checking in, like, checking out the drawers of the room and like, oh, what's in here? What's the view like? Putting our bags down and stuff. Signing some paperwork, doing the kind of routine stuff. And they didn't really start any like interventions until like 8 o'clock at night, it seemed like. It took a long time to like get things going, even though we knew what we were there for and what had to happen. Because they'd already kind of talked us through a little bit about, the different types of, cervical ripening and what type of tools might be used. And my birth plan was very like just go with the flow. Like I had really no strong preferences around like what or why or when. It was just kind of like whatever's safe, whatever you recommend, let's do this. And that's what ended up happening basically. So they ended up placing cervical ripening medication. I forget which one, but one of them, and literally had to wait a full like 24 hours for anything really started to change. And I remember just like kind of living our best life, in terms of like watching shows, just playing the games, kind of fooling around. It felt like we are ordering room service, for meals. My husband was complaining about, the uncomfortable couch he had to sleep on, all that sort of stuff. And then around that 24-hour mark after we'd like really checked in, like things started to like ramp up a little bit because I finally had some changing happening down there, and they were able to then do a Foley balloon, which for me was extremely uncomfortable. I remember I got up and I tried like walking around, because obviously they say, keep your body moving and all that. And I wanted to do that, but I was in so much physical pain that like I felt like I couldn't even walk. And I remember just like standing and crying and my husband holding me, and I was like, I don't know how I can do this. And I wasn't even contracting. And I was like, I don't know what's going on and I don't like it. And the nurse had come in and she was like, what's your hesitation around pain meds? And I'm like, I don't have any hesitation around pain meds. And I was shocked that they hadn't really offered me anything. And so luckily she ended up was able to offer me something. And that definitely helped. And I was able to get a good long nap in. So that was, really helpful. So I was really surprised that they hadn't offered it in conjunction with that intervention.
Yeah. And so was that just like an IV pain meds or that was the epidural?
I had IV pain meds at that time. Yep.
So once you're able to kind of relax a little bit with the medication and help the
Mhm.
pain, how did you progress with the Foley balloon? Did it end up falling out or how did it go after that?
So I got that placed around like 4 p.m., 4 to 5 p.m. And then I had the pain meds, and I want to say I napped for a good like 4 hours. And then when I woke up, I got to use the restroom and I had fallen out at that point. And then I started having some contractions and I was getting pretty uncomfortable. And they had talked to me a lot about like, as soon as you know that you want to have an epidural, like let us know, because we don't know when they're going to be able to come place it. So at that point, we decided to go ahead and go in that direction.
And with the Foley balloon, had they given you any other medication like Pitocin to that point to induce contractions, or it was just the balloon and then your body kind of picked up those contractions naturally?
I definitely had some Pitocin going on at the same time. I think what happened when they checked my cervix after the balloon had fallen out, they were like ready to start. Just well, we want to ride this rhythm of it, like of things progressing. So let's get going. I do remember them having to lower it because they were too close together before I got the epidural.
And so once you got the epidural, was your body able to kind of relax a bit more? How did you progress after that?
Yeah, so I definitely was able to fall asleep again after getting the epidural placed. And I remember waking up at this point, it was the next day, like early morning, around like 2 to 3 a.m. And they were really like, okay, like you're really now in active labor. I want to say I was around like 8 centimeters at that time. And they just kept like shifting me. I remember just feeling like a rotisserie chicken. Them just like rotating me like on my sides, left and right. I was using a peanut ball. Like it was just a lot at that point. And I remember my biggest frustration being the fact that the fetal heart rate monitor kept like falling off and they couldn't get a good read. And so like that created some sort of unnecessary panic, I think, at times. Just because it was like, oh, we can't find the heartbeat. And so you start to wonder like, well, is that because something's wrong? Or is this because the placement's off? Like what is going on there? Um, and I do remember before my son was born, them having to place like the internal monitoring system, which that, you know, I don't remember it being uncomfortable. I just remember it being like another cervical check, and it wasn't on there for very long, like, within 2 hours after that, he was born, but, um, it was definitely a very stressful, having to keep moving. At that point, like, it's hard to move because my epidural was working so well that, like, my whole lower half just felt like dead weight. So I was really relying on, like, the nurses and my husband to, like, get me where I needed to go.
After you were able to kind of relax a little bit with the epidural, they're moving you around. How much longer did it take you to be complete and fully dilate?
Yep, so I remember it was 11 a.m. They were like, "All right, you're ready to start pushing whenever you are." And I was like, "Oh, okay." And so I remember them, kind of giving me like a brief like coaching session, if you will. Like I hadn't, again, I kind of went into this really ignorant because I didn't really want to have a plan, have it not go according to plan, have that stress me out. So I didn't take any birthing classes. I didn't really prepare the way I probably should have. But I remember them like instructing me on how to bear down, and I pushed for 54 minutes. Honestly, it felt like 3 minutes. The whole thing was a blur. I remember being exhausted, and there was definitely some moments where I was like, "I don't know if this is gonna work or not." Um, what kinda helped me is ironically up in the ceiling of the room was this, like, I don't know if it was like a light meant for certain procedures, or like what exactly it was there for, but it kinda acted like a mirror, and even though I declined wanting to use a mirror, it definitely helped because there was a moment where they told me like, "Oh, he's right there," and I didn't believe them, but I glanced up and saw, like, he was right there, and I was like, "Oh, okay." And it kinda gave me that boost of, like, I am right there, I'm almost done, I'm about to meet my son, and that, like, really, like, helped power me through.
That's amazing. With the epidural, were you still able to feel a little bit to push, or was it a super strong epidural?
I was able to still feel, like, I was definitely, like, having the tightening of contractions, and they were doing a really good job of coaching me, like, "Okay, here's one coming," and even though I couldn't exactly believe that it was, like, I didn't feel it per se, it definitely, like, I just trusted them and knew they knew what they were talking about, and I had the sensation kind of aligning with it, so I just rolled with it.
And so once you see your little guy's head right there, once you were able to push him out, did they give him to you on your chest straight away?
They did. He ended up having a really low Apgar score, so it was really scary at first because he came out and he was not crying. He was blue. It was horrible, and we were all just kind of stunned. And again, I had this moment of like, okay, it happens. Like I went through all of this and I'm not even gonna have a baby. Like I was so like stunned and shocked. I remember saying, "Oh hi" to him as they placed him on my chest, but then they immediately took him away. And I was like, "Oh no, like what's wrong with him? Is he okay?" And I remember I kept asking, "Is he okay? Is he okay?" And no one was saying anything. And a nurse said, "Don't worry, he's in the best place possible." And I just like broke down because I was like, "Oh, they just reaffirmed it." Like that's it. 4 minutes later, I hear him cry. They had him over on the warmer, they were working on him. A lot of suction, kind of not CPR, but like, the compressions, whatever they're doing. They ended up taking him over to the NICU for 4 hours, and that was the longest 4 hours of my life. Um, and my husband was with him, so it was very a big blur of just, like I remember he started screaming and crying. So I had this big like sigh of relief, like, okay, at least he's alive. And they started to wheel him away. And I like yelled at my husband, like, go with him, like grab a phone, like go with him. Um, and then all of a sudden, like my room, I had like what felt like 20 people in the room because I was also delivering at a teaching hospital. So there was tons of students and who knows who in the room. And all of a sudden it was like me and this one nurse. And I was like, well, that was anticlimactic. Like, what just happened to me? I mean, she was phenomenal. She was great. And I started getting picture updates, from my husband once things settled down. But yeah, it was definitely a big blur of like, oh, okay. Like, I just did that. This is done. And where's my baby?
Right, and you go from all of that mayhem and commotion to just sitting in the room. That's a big a roller coaster
Yeah.
of
Yeah.
emotions for sure. So
Yeah.
you said he only had to be in the NICU for a few hours?
Yeah.
And was that just to work on breathing, or did they realize why he was having troubles breathing early on?
Nope. It was undiagnosed. Like, they have no explanation for it. And he didn't even need like oxygen. They just really had him there for monitoring for 4 hours.
Got it. And like you said,
Mm.
I know those it only in the big scheme of things is 4 hours, but I know
Right.
right at the
Right.
time, it's, like, excruciating and feels like forever. So
Yeah.
talk us through
Yeah.
once they were able to bring him back into the room, those early days in the hospital, and then once you got home postpartum.
Yeah, so I remember at one point before they brought him back, I had a cough, and I think it was I remember the whole time I had been sick the week before, and I had this like lingering cough to add to everything going on. And I remember coughing and feeling like a gush, and I was like, oh no. And I told the nurse, and she checked. She's like, oh, that is a lot of blood. And so I had to have an ultrasound to make sure there was no retained placenta. Everything checked out fine, but it was a real jarring experience to go from being pregnant and having these ultrasounds, almost weekly. It seemed like to then seeing like my empty uterus right after birth. And I was like, oh, okay. So I'm now completely empty and my son's in another room somewhere. So that was really hard. But everyone just acts like it was normal. And I'm like, this is really weird. They finally bring him back. And I just remember like really breaking down and being really emotional. Just relief really of being able to see him that he was here. I think I was still in denial for a full day of like, is this baby really mine? Like I kept joking with my husband, like, did you steal someone from the NICU and bring him back to me? And sometimes I even joke about that, but he looks just like me, so I can't really deny it. But yeah, I mean, it was just overall incredible experience, even though it was completely shocking in all ways. And in some ways it went exactly as planned, but then the actual birth itself went completely not as planned. But everything happened the way it had to happen, I think, in the best possible way because we ended up leaving, happy and healthy within like 48 hours after he was born.
That's great.
Hmm.
So once you got home in those early postpartum days, did you have an idea of how you wanted to feed, if you were gonna try breastfeeding, or how did that go?
So I decided during my pregnancy that I was going to try like exclusive pumping. I'm very much like the idea of not knowing how much like a baby is eating really kind of freaked me out. So I was like, how is he going to get enough? And I just never really had that confidence to just breastfeed completely. I also was really freaked out by like the idea of formula feeding only because like all the formula shortages that had happened like a year or two prior and how expensive it is and all of that. That I was like, if I can, provide breast milk, I want to do that, but I wasn't really hung up on like trying to latch with him. Like I from the get go was like I'm gonna pump, and I remember like sitting at my pump like while he was in the NICU and starting to get stuff going there. Fortunately, I had a pretty decent supply pretty early on. Definitely left with some donor milk to help us get through those first couple days, but luckily didn't really need it much beyond that. So we were able to successfully pump and feed. I remember there was a point around 8 weeks that I was like in a moment of like desperation. Like all my stuff was dirty, nothing was clean, there was no bottles. He was screaming, so hungry. And I, on a whim, just like see if he'll take it. And he latched. And it was like an amazing, incredible experience of like, oh my goodness, like, oh, wow, okay. I'm like, this is not easy, but like easy. Um, and so we didn't switch to breastfeeding solely. It became more of like a comfort thing or a convenience thing. So I still primarily bottle fed, but we would do a nursing session at night before bed typically, or if he woke up in the middle of the night, we would nurse. But during the day, he'd always have his pumped bottles.
That's great to be able to kind of combo feed that way, and you usually hear I know some people get breached to, "Oh, if you don't latch immediately, like, you're not gonna have a supply, your baby will never do it," and then
Hmm.
I think you're a testament that, like, Sometimes it just works even when you
Yeah.
try it later on.
Yeah, no idea. Like no secret. I don't even know how it happened. It just happened, and we're very fortunate that it did because it was a great bonding experience for sure. But I definitely can see, as I'm somebody who gets tapped out pretty easily, that I wouldn't have wanted to do that for a full year.
Yeah, understandable for sure. So, at what point did you conclude your pumping journey? About how long did that last?
We made it a full year, and a full year to 12 months, and then I continued like an extra month just to kind of like gradually wean down. So about 13 months in total, he was on exclusive breast milk.
That's great. That's super great.
Mhm.
So, kind of jumping forward ahead to the next,
Mhm.
were you looking to get pregnant that time, or did you consider, like, oh, we might have to do medicated cycles again?
Yeah, so I honestly was on the fence about whether I even wanted another kiddo. My husband was like gun ho, like if he had his way, like, we would still be having babies, even though we've closed that chapter now. Basically, I kind of left it as if we have one, great. If not, no big deal. Like I'll be content with the family that we have. In the back of my mind, I was always like, well, what if we do want another? And we do have a pretty big age gap between our first two. And so um I really kind of wanted to make sure that my son had a sibling closer in age if possible. So what right before he turned 2, I decided to get my IUD removed that I had placed at 6 weeks postpartum. And I kinda just said, we'll leave it up to fate. I'm not gonna become crazy and track again like I have before. I'm not gonna ask for any interventions. We'll just see what happens. And shockingly, within 1 cycle, I got pregnant,
Oh
and
my
I couldn't
goodness.
believe it. Like, I was shocked, and my husband was shocked. Like, he almost joked, like, "Did you have an affair? Because this is ridiculous." Because we really truly thought it was gonna be years before another. And so we were definitely surprised that it was a week before my son turned 2, we found out we were expecting my daughter.
That is so incredible, and for it to happen similarly to the first where you were expecting it to take longer and kind of resigned yourself to that fact, and then it to happen straight
Mhm.
away, that is exciting. So, was it the same situation? Did you get that headache this time, or did you
Did.
just
I did. I had the head I was putting my I remember putting my son down, and he was very much in that stage where, like, he would go in his crib, but, like, I had to, like, lay in his room for, like, what feels like hours, and I was laying there, and I'm like, "Oh, my head really hurts." So I was like, "Oh, what?" Hold on. It's hard to describe the type of headache it is, and I don't usually have headaches, unless it's something directly related to, like, I haven't had enough coffee, or I can usually pinpoint like why my head hurts. Like I either slept on my neck wrong or something. And it's out of the blue, this just like shooting pain in my head. And I'm like, that's my pregnancy headache. Am I really pregnant? And I remember tearing apart my bathroom looking for pregnancy tests. And then the ones we had, they weren't expired, but they weren't new. And I was like, so I had like that period of time where I was like, I need to run out and get more tests. And I had sent my husband out to get more tests that night because I told him initially. And so I literally was just like, this can't be real. And I was like the faintest of lines, like faint, 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 faint. And I remember texting my friend who's like my go-to person. And I was like, what do you think of this? And she was like, there's a line. And I was like, I see it too. My husband's blind as a bat and was like, I don't know what you're talking about. You're crazy.
I feel like
Um,
that's such the common husband, like, "I don't see anything," and you're like, "There is something
I'm
there."
like, there's something there. I'm like, look. And he's like, no. So he brings home like all the pregnancy tests. And because again, he's oblivious, even though we've been through this for years. He's like, which brands, like which type. He brings like one of every one, basically. Probably spent like $75 on tests at Walmart at 9 o'clock at night. And it was one of those situations where, the line was there. We could see it was faint, but it was there. And the digital saying negative. So he's like, oh, you're not pregnant. And I'm like, I know this. In 4 days' time, this will say pregnant. And I was right. Um,
You're like, "My head does not lie." That's so exciting. So, did you keep testing, like, each of those
oh
days
yeah.
to
Yeah.
wait?
Hmm.
That's so funny. And did you see that line gradually get darker and darker?
Yeah. Yeah. Which I
That
know they always say like that's not an indicator of a healthy pregnancy. I know that, but it was reassuring to know that at least it was trending in the right like upward trajectory.
Yeah, for sure. So, with this pregnancy, did you decide that you wanted to go to that hospital that you delivered at before, or did you choose to go to a different OB?
So I knew that I was going to have to deliver there again because at that point even though I had lost weight during my first pregnancy, I'd regained weight back, and I was around the same that I was around the time, like when I had my first pregnancy. So I knew I was going to deliver at that hospital. I decided to just have my OB be with the specialty clinic that works with that hospital, to avoid there being like miscommunication. One thing I forgot to mention was when I checked in for my induction, I remember them asking me if I had any prenatal care, and I laughed because I was seen what felt like every other day, because I was so high risk, and they didn't send my records over, even though I had to plan induction. And so it was just one of those things where I was like, I had to tell them like, oh yeah, I was negative group B strap and all that because they were like, oh, did you get your test done? Like, they had no
So you
idea.
were filling them in on all of the information.
Right. Yep. Like
Wow.
I like logged into my patient portal to show them like results of things because it was just easier that way. I'm like, this is so unacceptable. So I just went straight with that provider from the get go, which just made things easier because they had access to the same portal essentially, which was nice.
Did you have any different symptoms or did you have a little bit of that same nausea?
Same nausea, maybe a little bit earlier. And I remember it being stronger, but it actually went away quicker, I think. With my first pregnancy, I feel like it kind of came and went still within the second trimester a little bit. But it definitely eased up.
And then with that quote unquote gestational diabetes diagnosis early on in the first one, how did they treat that with this one? Did they automatically have you do a glucose test or how did that play out?
I was so relieved to learn that this clinic that I went through, they do an A1C test at 12 weeks. And so that came back fine. So I'm like, no need to do anything early. Just live your life the way you've been living it. They obviously recommended, a low carb diet and all that sort of stuff being, a bigger size. But I did the standard 27-week test that most other people do. And I knew when I was having it. So I didn't have a carby breakfast. I remember having like a protein shake and my regular coffee and passed with flying colors. So it wasn't a concern.
It's so interesting how each clinic can handle it from time to time. And then, even with numbers being a certain thing, sometimes they just slap on a gestational diabetes diagnosis because of
Right.
our size. So,
Right.
it's good that that clinic was actually thorough in saying, let's just take the
Mhm.
overall picture. And
Right.
then you didn't have to deal with the insulin and things like that.
Yeah.
So, did the end of pregnancy, second and third trimester go pretty well?
For the most part, I definitely had some high blood pressure concerns my second pregnancy, and I think honestly some of it may have been I don't want to say self-induced, but I delivered in August, middle of August, and this was like the hottest summer we've had in years, and I was still working full time, and then chasing after a toddler, like it was just a lot. And I've always been one of those people that like I'm on the cusp of having like regular high blood pressure, like I call it like white coat syndrome. I don't know if it's true or not. I'm not typically on routine high blood pressure medication on the day to day, but it was definitely something that was on our radar. So I started taking labetalol around 30 weeks. And I had a ton of labor and delivery triage, like blood pressure checks mixed with NSTs for the last 8 weeks of pregnancy. And every time we went in, it was like, who knows if this could be it? Especially because I was diagnosed with preeclampsia on my first delivery. Thankfully, I didn't need any intervention, like regarding magnesium or anything like that at the time. And I didn't with my second one either. And I never officially diagnosed with preeclamptic my second pregnancy, but I was considered gestational hypertension. So they induced at 30 weeks again for that.
And did you have the same experience where they were letting you know, "Okay, here's the day, you wait around," or did you make plans this time?
So that's they gave us the day and I knew that from the last time. So we kind of waited till last minute to drop the kids where they needed to go. And we actually went out to breakfast. And during breakfast got the phone call being like, hey, when can you get here? And I'm like, well, we're wrapping things up now. So it was kind of nice that instead of us waiting around for them, like they had to wait around for us a little bit. And that was just a much nicer pace. We were able to like have our last breakfast as a family of four. We then dropped the kids off and we were able to go and have our daughter.
That's awesome. So when you got there this time, they had all of your medical records and
Yes.
you didn't need to debrief them. Talk us
Mhm.
through that early part of induction. This time, did it go pretty similarly with the cervical ripening?
Oh my gosh, it was 1,000 times quicker, faster. I don't know if it's just because I was more informed or what the case was, but we got in there and things just everything went by so much more fast. It was like people knew what was happening. I don't know if it's because it was the second time birthing mom, and they were just like, "Hey, like, you know the drill now," or I do know that part of it was that they have changed their policy where they do the cervical ripening, um, they do the medication and the Foley balloon simultaneously, to, like, speed things up. So, they went to go do a cervical check, and I was already 2 centimeters dilated, which was I was pleasantly surprised about, and so they're able to do the balloon right then and there, and I had advocated for myself and said, "The last time I hated that. What can you give me for pain meds?" So simultaneously, I was able to be medicated, and it was much more manageable.
That's great. I know that Foley balloon can be a doozy, so it's nice that this time you knew what to expect and could kind of preemptively
Mhm.
manage that pain. So, same thing this time, did you keep the Foley balloon until it fell out?
I did, and it was only in for, like, an hour, like,
Oh,
it was
wow.
very fast. It was like my husband wasn't even in the room, like, he went to the car to get I had left my fan that I wanted to bring in to attach to my hospital bed, and he was like, "You need to go get the fan, like, I'm really warm." I think it's because they give me fentanyl for pain meds, and I was, like, sweating, and I was like, "I need a fan in here stat, like, you go get that," and by the time he came back upstairs, it was already out.
So, at that point, were contractions picking up as well?
Yeah, yeah, for sure. I definitely remember, um, everything being more intense and faster. I don't know if it was because I don't know if it's because I had the pain medication with the Foley balloon that it was just, like, dulling things down a little bit, like, I felt it, but I could tolerate it pretty well. And I remember thinking to myself, like, "When am I gonna get my epidural?" Because I didn't feel like I needed it, but I could definitely feel it, and it was intense, and all of my at that time, they had started Pitocin, so, like, I was having Pitocin contractions, and so I checked in, it was 2 o'clock in the afternoon. The balloon was out by, like, 4 at the latest, and I remember I don't think they did another cervical check until, like, 8 o'clock, and I was already at, like, a 7. Um, and so they're like, "Yeah, whenever you're kinda ready for your epidural, let us know," and I was still doing okay, and around midnight, I remember asking my nurse, like, "I think I need the epidural now," like, things were, like, really amping up, and they slowed down the Pitocin because my contractions were getting really close together again, and I think the nurse was trying to encourage me not to get an epidural in some ways because she was like, "You're doing really well and, like, you're progressing really fast, like, you may not need one." And I was like, "Well, I want one. So can you please let them know that, like, I'm, asking for them to come as soon as they can?" And the anesthesiologist was busy. They were doing, like, an emergency C-section or something, so it was gonna be a little while. I was like, "Okay, great." They finally came around 4 o'clock to place my epidural. And I remember them saying, like, "Are you sure you don't wanna have another check done before you get it?" And I'm like, "I don't want another cervical check until I have an epidural," because I was a little concerned they were gonna tell me I was too far along. And at that point, they had tried breaking my water, and it just wasn't ideal. They kept saying, like, it wasn't the ideal situation because they described it as, like, trying to break a water balloon and how, like, if you don't have a good enough grip on it, it's gonna go the other way. Um, and so they weren't able to break my water right away initially. They then got my epidural. I remember it was right around 4 o'clock they placed it. And I don't even think it fully took effect because when they did my next cervical check, I was ready. Um, and my water still hadn't broken. So they were trying to break my water. And I remember they said they did, but there wasn't the climatic, like, waters everywhere. So I almost wonder if, like, I had a slow leak or something because it was so not dramatic. And then I ended up needing to have something called an amnioinfusion done, which, because at this point, my daughter was starting to have some D cells. And so they were getting really concerned that we may have to go to a C-section because she dropped down to, like, 60, like, really fast. And they were like, people were frantic. And all of a sudden, again, there was a bunch of people in my room and they were talking about prepping the OR. And the whole time I remember just thinking, all I wanted was a nap. Because I was expecting to get my epidural and to get a nap, but at this point I hadn't slept at all. And my husband has slept through most of this. And I was like, okay, he needs to get up now because you're talking about the OR, like, he needs to get ready if that's going to happen. So I just remember they did the amnio infusion, which allows, I guess, some more waters. They can get pressure, I think, off of her cord because that's essentially what was happening. And they were able to do that. And I remember telling them, like, I just need people to slow down for a moment. And so everyone, like, backed off for a second. And then we started pushing. Because I was at a 10 by 5 a.m. And then she was born at 5:22.
So, much
So,
quicker progress throughout that.
yes. Yeah.
So, with the amnio infusion, were they confident that that would at least buy you a little more time, or were they still considering a C-section at that point?
They were still considering a C-section. They said this is giving us time to, like, relieve the pressure off of her cord because they couldn't see where her cord was, but they had a feeling that was what was happening, was that somehow in the canal, it was creating too much pressure on her cord. That was what was causing the D cells. So that gave us enough time, I think, to just like orient and group ourselves. And then they're like, you're not going to have a ton of time to push if this is what's going on. So like, give it your all. And I remember doing a first like couple like practice pushes, and like I wasn't getting it initially right away. I think it's just that I was so tired. Like I was almost delirious of like, what is happening? Like I knew what I had to do, but like I was so tired. And so I remember just like sitting there for a moment, taking some deep breaths and saying like, okay, like let's do this. Um, and then once I got in the groove of it, things were like, it was fine.
Once she came out, were they concerned with those D cells? Did they take her straight away, or were they able to give her to you this time?
They were able to give her to us right away. And I was shocked because again, she wasn't crying. And I was like, what is this deal with my baby's not crying with her born? Like, what is going on? Yeah, like it was I remember again being like, "Oh no, like she's not crying. What's wrong? Is she okay?" And I was even more concerned this time because they were talking about the OR. So I was like, "What just happened?" Like I was prepping myself mentally for a C-section 15 minutes ago. My baby's not crying, but everyone was like, there was no rush, there was no panic. They're like, "Oh, she's good, she's great." And I'm like, "Are you sure? Like she's not crying?" And so I think the difference was that so my son had an Apgar of 1 and 8 when he was born. Hers was 7 and 8. So she was completely fine other than the fact that she wasn't crying. So, they were able to, clean her up real quick. They gave her to me right away. And we had the full like hour of golden hour where she was able to, be on my chest and be with us. And it was amazing. My husband cut her umbilical cord, which he wasn't able to do with our son because of the chaos. So it was all just kind of like a really healing kind of moment where it was like everything really went. We had the initial scare, but other than that, everything really went as planned.
That's awesome. And so with the quick pushing phase, did you tear it all with your daughter?
Surprisingly, I didn't, and I was shocked. I think I had, like, some superficial tearing, but, like, nothing that required any stitches. With my son, I did have a second-degree tear and needed stitches with him, and I think a lot of it, honestly, was that I could feel a lot more the second time around because I really don't think my epidural had much time to do what it really intended to do. I remember there was a point where I had to move my legs, and the nursing staff was, like, prepared to lift my legs for me, and I was doing it on my own before they even were doing it, and they're like, "How are you doing that?" And I'm like, "I don't know. I'm just winging it."
You're like, I don't think this epidural is working. Let's just get this baby out.
Yeah, I'm not quite sure what is it isn't working. I'm not sure what I feel anymore at this point. We're just rolling with it.
Yeah, it's just a blur at that point, like you
Yeah,
said, with
exactly.
sleep deprivation and all of the
Mhm.
the scare initially of,
Yep,
oh, we're going to the OR, and then to have your baby on your chest, you're like, what just happened?
literally. Like, with the whole thing was within 12 hours, and when you compare it to the first one that was over 2 days, it's like, "How what?"
Yep. You're like, sign me up for that plan, please.
Yeah, no, it was great, but a part of me is like, I still joke that I really wanted that, that epidural nap is something else. It's like your
Yeah,
last
and you're
good
like,
sleep.
excuse me, I am not getting a nap. Can we delay this a little? So this time, did you kind of plan to exclusively pump as well?
I was more open to like trying to latch at the hospital if possible. Again, not that I wanted to exclusively breastfeed. Like I knew pumping would be part of my journey considering I work full time. So, and my maternity leave is only 12 weeks. So for me, I knew it was going to be our primary way of feeding. But I did try latching. It wasn't great. Like she definitely struggled with it. Definitely not her like favorite thing. So I've mostly been pumping for her pretty exclusively. I don't even really try to nurse anymore if I'm being honest. But our first like 4 to 5 weeks we would nurse occasionally. But again, like I was always nervous about how much she was getting. So I just preferred to bottle feed.
Got it. And your supply has been pretty good this
Yeah.
time as well?
Hmm. Yeah.
That's awesome. Well, that is super great, Melissa. I really appreciate you sharing both of those stories that very clearly show that an induction can go many different ways.
Yep.
You never know between first or second or just person to person how an induction can go, and then being able to have them vaginally with minimal issues. So that's
Hmm.
super great to hear your story, and I know will help a lot of other moms that are either considering induction, kind of weighing their options. I think that's a great testament to your story. Do you have any resources? I know you said you tried to steer clear of like birth plan specific things, but did you have any resources throughout your pregnancy that you used that you found particularly helpful?
Um, I think just definitely being open to talking to whoever you have in your life, that's experienced it, especially if they are similar size and you're like, hey, I know that you had a baby and we're, around the same size. Cause I definitely was able to connect with, Some folks I hadn't spoken to in a while, but like people from high school, for instance, and we're still Facebook friends and just being like, hey, did you have a good experience? And just being able to talk, especially if they lived locally, like tell me about how it was like delivering at, insert hospital here, and get their thoughts and feelings on it like firsthand, I think is really important because I feel like the internet, you either hear the really successful stories or the really horrible stories. And there's hard to hear like the in betweens of what's actually real. And I remember finding myself in like a social media hole of like, all of a sudden you then hear about stillbirths or you start hearing about all these like terrible, terrible things. And once you click on the one, you then see five more with the algorithm. So try not to scare yourself by going into the deep and the dark scaries.
Yeah, absolutely. And I think, like you said, I feel with social media, it's so easy to just hear the bad, the bad, the bad. That sometimes if it goes like pretty well, that doesn't make a great story. So people aren't sharing that when usually that's probably the majority of the stories.
Mhm.
So I agree, not getting in a negative mindset just because social media is pushing you the the negative
Right.
content.
Right.
Well, awesome, Melissa. Again, I really appreciate you coming on and sharing your story with us, and we will talk to you on the next one.
Sounds good. Thanks so much.
Thank you so much for spending part of your day with us. If you enjoyed this episode and want more stories just like this one, please be sure to like and follow us wherever you listen to podcasts. Also, if you have a moment, please consider leaving us a positive review wherever you're listening to this show. These reviews are the best way for the algorithm to push out our show and get us in front of other plus-size moms who may be looking for a community like this one. Your kind words can help make sure that no one has to go through this journey alone. If you are a fellow plus-size mom and would be interested in sharing your story, please reach out to us at biggerthanbirthpodcast@gmail.com. Use the subject line, "Share my story," and I will be sure to get back to you as soon as possible. Want to put a face to a voice? Head over to any of our social media pages linked in the show notes below to see more photos of today's guest. Any resources or topics discussed in today's episodes will also be linked below. Thanks again for being a part of the Bigger Than Birth community, and we will see you next week. Bye!